What are the symptoms of a brain tumor? Number 1. Headache. The most common and important symptom of a brain tumor is headache. However, you have to keep in mind that headache is a very common symptom among the general population, and most people with a headache do not have a brain tumor. So, when should you be worried that your headache might possibly be related to a brain tumor? Well, one red flag is if your headache wakes you up from sleep or if you wake up in the morning with a headache. The other thing is that if your headache worsens with coughing, sneezing, or change in body position, such as bending forward, then you will need to see your doctor for further checkup. You will probably need some sort of imaging of your brain to check for brain tumors. You should also be worried if your headache has changed its pattern. Remember that headaches from brain tumors can present in different patterns. So, that is why any new onset headache or any change in the pattern of your migraines can be a red flag for a brain tumor. The reason behind this is that brain tumors will cause an increased pressure within your brain, known as intracranial hypertension. Number 2. Seizures. A new onset seizure involving your whole body or just part of your body, such as your right or left arm, can be a symptom of an underlying brain tumor and will warrant further imaging of your brain. It is interesting to know that seizures do not always cause shaking of your body. For example, if the tumor is involving your temporal lobe, then a seizure might just present with a sudden arrest of speech or just feeling a burning smell. So, beware. Number 3. Focal deficits. Depending on the size and location of the brain tumor, you might develop different focal symptoms, such as weakness or numbness of an arm or a leg. If the tumor is involving your speech center, then you might find yourself with problems getting your words out. These symptoms can gradually worsen as the tumor grows. Number 4. Cognitive problems. Brain tumors can cause all types of cognitive problems. They can cause memory problems or even changes in personality. There have been adult patients who suddenly developed childish behavior or a super nice and outgoing personality. Even a new onset of depressive symptoms can be due to an underlying brain tumor. In a nutshell, any change from your baseline cognitive functioning can mean an underlying brain tumor. Number 5. Syncopal episodes. Most people with syncopal episodes will not have a brain tumor. However, if you are a person with new onset headaches and is now experiencing syncopal episodes, then be vigilant and seek medical attention. Brain tumors can cause syncopal episodes, and the reason is, again, the increased pressure in your brain. The more pressure that builds up in your brain tissue, the harder it gets for blood to reach the brain. This can easily lead to syncopal episodes, especially following a cough or a sneeze. So, these were the 5 most common and important symptoms of a brain tumor. Keep in mind that brain tumors can also be asymptomatic and not produce any sign or symptoms. However, if any of the mentioned symptoms occur, make sure to seek medical attention before it gets too